Hi, and welcome back to PainFreeFinally.com. Your host, Greg Rollett, here with Houston's senior specialist, Dr. John Trowbridge. And right in front of us, we have the knee. The knee. And this is, obviously one of the parts of our body that we need on a daily basis.
Yes.
It helps with the walking, apparently, and the running and the chasing of the kids and the standing and all of that stuff. So many people today. Knee injuries.
Exactly.
Whether it's full-blown cartilage to tendons to just joints to lots of stuff going on with the knee, and I hear about it more than ever. My dad's got had 2 knee replacements. You just hear these horror stories.
Everybody gets knee replacements now.
Yeah, it seems like it's the thing, but there's got to be a better way, right? Which is
obviously
why we're talking
here
today.
Much better way. In full disclosure, this is a right knee, because the other one is similar but not quite.
Correct.
Okay. But knees are one of those special joints. First of all, they carry all the body weight. And when you think about it, we stand 2-legged, but we walk 1-legged, okay? So all the weight is coming down here. Very special that you keep this knee in place so that it doesn't slip off the bottom bones, okay? And so we have all these structures like buried on the inside. Whoops, these are called the cruciate ligaments or crisscross ligaments.
Yep.
They help keep it in place. These ones on the side are called the medial collateral, the lateral collateral. I'm having to say this so that everybody knows there's fancy doctor
Exactly,
talk here.
yeah.
And this is the patella or the kneecap, all right? Now, the neat thing is that all of this is held together until it isn't. And how do we do it differently? Well, it's called the plant and turn injury. We do that in volleyball, basketball, tennis, football.
I do it in chasing the kids.
Exactly. And so when the knee is working as a hinge, that's great. But when you plant the foot and twist it, you start tearing these things. And there are very important little discs here on the inside and outside sections of the knee, which keep everything sliding and gliding in exactly the right channels until you don't. And when all this starts to happen, you start to wobble. And as you wobble like that, your body senses it and tries to hold it still, so it gets stiff and sore. And you start complaining, can't walk that far, don't want to walk that much, whatever. Getting up out of a chair, out of the car can be discomforting.
Right.
Stairs can sometimes be impossible. And so what happens with the knee is you begin to think, I better get some surgery or some medication. Let's do medications first.
Right, let's just see if I can get rid of the pain.
Exactly. And actually you can cover the pain until you can't. And that's always a glitch.
Yeah, because you're not fixing anything.
Exactly.
So you're continuing to put pressure on it every day.
It's getting worse with the wobble, exactly.
Every day.
And the problem is that you got a lot more days in your life that you're planning to use this knee.
I would hope so.
Exactly. And of course, when you start having to protect this one, you're overusing the other one. And that's why people end up with double sets is, not only have they injured one knee, but they gradually wear down the other. People come in and they say, I'm going to have surgery because the doc says I have bone-on-bone arthritis. And I go, okay, but you don't. And they go, why do you say that?
My doc said that I do.
He said it was. And I said, because you're sitting there and your leg is bent like this. Now, did you walk in with your leg bent like that or was it straight? Oh, it was straight. And I said, okay, then it can't be bone on bone. You still have enough padding in there to be able to move it.
Right.
Unless it's excruciatingly painful. Well, no. Okay, then you still got
There's
some of the
something
texture
there.
in there.
Yeah.
Exactly. And that's what we build on. The beauty of fixing a knee is when you get the support structures fixed and you get the slide and glide structures fixed, people are suddenly more comfortable and capable. And it can be fairly suddenly. It can be within a matter of days or even weeks.
Wow.
That they get better. Now, the nice news is you're healing yourself with the stem cells. We do injections into the joint. We find the right tissues because we kind of want to focus on those, and you start repairing it yourself. That's your own natural healing. Well, that's the way God intended it, is to build back up and work the right way, and it actually does repair.
Yeah.
Can be remarkable.
I love this idea of again, natural healing, the way that it was intended to be.
Exactly.
Because, screws and plates and all these fun things, they weren't intended to be in our body, right? And so talk to me a little bit about the difference between someone who's, planning to, doc, I'm going to get surgery.
Right.
And let's find another way.
Well, one of the informed consent choices for surgery is you should be told, numbers of these loosen up. And you've heard the news reports, And the problem is, when they loosen up, they have actually cut away your own bone. Okay, you will never get that back.
No, it doesn't grow back.
You now need the next appliance that they have.
Yeah.
Unless, of course, there's a difficulty fitting that appliance for your knee, in which case you might end up not having one.
Yeah.
Or they might recommend that we fuse it or we do some other fancy surgical things and so on. The problem is that these are really natural slide and glide surfaces. The surgical ones are not held in the same way, and repeat operations just have more and more risk. Now, I happen to know a little bit about knees, since I ripped the tendon here from the top of my kneecap and all the muscles came off when I slipped and fell in my own dining room. If you put your left foot under your butt and there's not enough leg to make that, something's got to give. Okay, so I ripped this all off, and of course I had surgery the next day.
Yeah.
And very thankfully so. I mean, that's what surgeons are for, is
Yeah.
when you have a crisis, they can help
in the
solve
right
it.
situation. Yeah.
Exactly. But of course, when you do that, you also weaken these other tissues because they got kind of abused in the process.
Yeah.
So, 6 years later, 5 years later, minding my own manners, getting out of the back seat of a car in Florida at a medical meeting, and stood up just wrong and put enough pressure right here that I cracked the disc, the meniscus, and knew it right away because of the white lightning pain. Now, I happened to go upstairs to the restaurant, you know, no elevators and
Of course.
beachside restaurants
Right.
in Florida.
Yeah, obviously.
And so I sit down, and shortly one of my friends from many years comes along, has a seat, we're talking, and he said, "What's new?" He says, "I'm starting to do stem cells." "Really? Legal?" He said, "Yes." And I said, "FDA approved?" He says, "Yes." And I said, "All states?" You know, okay. "Tell me about them." He says, "Well, they just came out the month before." And he said, "I treated this guy with his knee." And I said,
tell me more.
Yeah, tell me more. And he says, "I just saw him back. It's been 6 weeks." And he says, "Doc," he says, "I am walking a lot better." He says, "Yeah, I can see with how well your knee is moving." He says, "No." He says, "Doc, remember, I have COPD." And he says, "Yeah." He says, "I'm not using my inhalers anymore."
Whoa.
Whoa, okay, now my ears are really perked up. He treated his knee because that's where the injury was.
Yeah.
Okay. And those cells stuck around there to do that, but also went off to find other things. That's the beauty of your natural healing, because your body signals the need for repair by inflammation. And so these cells went off. Well, of course, I immediately had an interest. 3 days later, I was getting my knee treated with stem cells. Dramatic recovery. I mean, literally dramatic recovery.
Yeah.
Then 11 months later, I told you this story on the other edition, I get up out of the chair just wrong, and I'm hobbling again. Oh, I have to get more stem cells. And 30 hours later, it was fine. So they nest around, they stay, just like your stem cells nest and stay in place.
Yeah.
They can hang around and be ready for the next repair.
Wow.
The beauty of it is, even as complicated as a knee is, and it's wonderful surgery, I love doing that surgery actually, doing the stem cells can be remarkable for comfort and capability. So, you know, I tell people, you deserve more.
Yeah.
You deserve the best that I use for me.
Totally.
For my healing and future health.
I love that. Now, for those who are watching right now and they have knee issues, where do they, you know, and they're thinking about surgery, they're thinking about this. Maybe they're on prescription drugs right now.
Oh, I'm sure they are.
Yeah. What do we do? What's the first step?
Go to PainFreeFinally.com, step one.
Yep.
Okay, and we have lots of information on the website. We've got DVDs, my book is there. You've got a quiz, and that's the beautiful part, is a quiz that you can take and go, this is what's going on with me, and find out kind of how you are compared to other people and such. You can also fill out a form and say, hey, here's what's going on with me, here's my x-ray report and so on. Is this something that could be useful for me?
Yeah.
And the idea is, you know, I don't want you to travel and see me if it's not going to be
I can't
helpful
help
for
you.
you.
Yeah.
Exactly. You want results, not the procedure. You're not after what I do, you're after the result I can offer.
Yeah, which is being pain-free.
Finally.
I love that.
Exactly.
And again, I love that you've set up the website, you've set up the quiz, and all these ways for people to see if this is right, because it's not right for everyone.
Correct.
It's right for the right patient, and you need that information.
And you know, people go, you really think I need surgery? Well, you know, I trained in surgery. I know what surgery can do, and I know what limitations there are in other treatments like the stem cells. If that's what you need, why wouldn't I give you the best advice?
Exactly. That's what we want, the best advice, and not only just the advice, again, what you said, we want the results. And if you want the results, you want to be pain-free finally, you want to walk without that pain of, you know, getting out of bed, going up the stairs, you know, doing the things that you need to do on a regular basis, go to PainFreeFinally.com, take the quiz, submit that information, and see if stem cell treatment is right for you. Again, PainFreeFinally.com, and we look forward to making you pain-free finally.